Hello, dear colleagues. My name is Liudvikas Granickas. I'm working as a radiologist for about 10 years. My location is in Klaipėda, which is a town of Lithuania. Today, my topic is breast magnetic resonance imaging. Is it recommended for every woman? And also, I want to make a short review for automatic breast ultrasound. As you already know, for breast examination, we are using three major modalities, which are mammography, ultrasound, and MRI. There are the other modalities like tomosynthesis, scintillammography, contrast-enhanced mammography, and positron emission mammography. Also in Russia, you are using electrical impedance technique, which is, in my opinion, is quite good, but in Europe is it not widely used. The principles of the operation is based on quantum physics, which is one of the interesting scientists I have ever read. It says that one particle can be in two places at once, or the same particle can cross you without touching you. It sounds crazy, but MRI is based on all that crazy ideas. Up to 60% of the human adult body is made of the water. Water is composed of one oxygen atom and two hydrogen atoms. One hydrogen atom consists of a single proton and single electron. When a proton is placed to a magnetic field, it lifts to upper energy level, and after relaxation, a proton goes back to neutral energy level at the same time radiating the energy out, which can be detected by detectors. For example, bones do not have much water. That means in the bones there are less protons, atoms, and that's why MRI are not suitable for the bones exam. So the first breast MRI scan was made in 1973, but image quality was insufficient for medical use. After 7 years, in 1980, the first breast coil was invented, which have lifted image resolution up, but still it was not enough for medical use, and only in 1990, after contrast media was injected, the modern breast MRI scan was made. So for the breast MRI, you need to have MRI machine, breast coil, and contrast media injector. There is no evidence that 3 Tesla MRI machine gives you better image quality than 1.5 Tesla machine. Image quality mostly depends on breast coil channel array. 16 channel coil gives you better result than 8 or 4 channel coil. Breast MRI is often used in women who already have been diagnosed with breast cancer to help measure the size of the cancer, to look for other tumors in the breast, and to check for tumors in the opposite breast before surgery. Also, it is used during neoadjuvant chemotherapy to check residual malignancy, to find primary breast cancer for the patients with lymphadenopathy, and to gather no evidence of cancer during mammography and ultrasound scan. To check for multicentric lesions for the patients younger than 40 years of age, and for the patients with aggressive form of cancer like lobular carcinoma and others. Also, it is used for women at high risk for breast cancer, but not every woman who has been diagnosed with breast cancer needs breast MRI. For example, if the cancer type is luminal A, or if you are not expecting its multicentric form, you don't need to make the MRI exam. For women at high risk for breast cancer, we have to make MRI scan every 2 years. So who are them? There is a personal history of invasive breast cancer. If there is a gene mutations like BRCA1 or BRCA2, if there is a first-degree relatives of people with BRCA1 and BRCA2 mutations, but the patients themselves had been tested for BRCA1 or BRCA2, and if there was a radiation treatment to the chest area before age of 30 years. MRI exam is very sensitive for small tumors. For example, about 40 and 50% of all tumors have found on MRI should be smaller than 1 centimeters. MRI is very sensitive for residual tumor or recurrence after surgery. It is sensitive for evaluating T stage. There are low influence of glandular tissue. Also, it helps to identify primary tumor for the patients with axillary lymphadenopathy. And actually, in 2% of all cases with primary lymphadenopathy, we are not able to find the cancer within breast. And like the other modalities, breast MRI have its disadvantages, like microcalcifications are occult. And I want to remember you that about 50% of DCIS starts with microcalcifications. Also, there is high false positive rate that increases the number of unnecessary biopsy. It is because not only malignant lesions accumulate contrast material, but sometimes benign lesions do it as well. And frequently you diagnose pathological contrast material uptake in the breast tissue, but you don't know it is benign or is malignant. And that leads you to a biopsy. It is frequently situation, especially for young women who are examining because of high risk indications. Also, during an exam, as I mentioned before, we are using contrast material which is toxic to the kidneys. MRI takes about 35% for one study, but is much more than mammography or ultrasound. Also, it is much more expensive. And of course, it is unsuitable for the patients with metal implants. I want to show you some clinical cases to help understand the possibilities of MRI. So let's start with case number 1. 40 years old patient came for a mammography because of existence palpable lump in the left breast. Because of the glandular tissue, there is no clear evidence of cancer in both breasts, in both breasts on the mammograms. During an ultrasound scan, I found probably malignant lesion in the upper outer quadrant of the left breast. An ultrasound-guided biopsy was performed, which revealed infiltrating ductal carcinoma. Because of the young patient age, the MRI was indicated. This is a dynamic T1 scan with subtraction. There is a malignant lesion in the left breast. Also, there is nodular enhancement in the opposite breast. I had to perform an ultrasound exam for the second look, and I have found multiple soft, well-rounded lesions which didn't appear suspicious at first ultrasound scan. I took the sample of them and later found ductal carcinoma in situ. After MRI, we often repeat an ultrasound scan, and it is a casual situation. Clinical case number 2. 78-year-old patient is feeling the lump in the right breast for about 15 years, which occurred after a traumatic injury. According to the patient, the lump was examined before, but nothing bad was found. As you can see, there is the global asymmetry in the right breast. There is no clear evidence of the cancer. Also, I didn't find any changes during an ultrasound exam because of palpable lump of the endosymmetric tissue in the right breast. In the right breast, MRI exam was performed, which revealed the symmetric contrast material uptake in the right breast. I had to perform an ultrasound exam for the second look, and during it in the right breast I found small amount of ductus which are not enlarged or forming a tumor, but comparing with the whole breast they are slightly abnormal. I took a sample of them and found ductal carcinoma in situ. At present there are 2 automatic breast ultrasound machines in Lithuania. One of them appeared at my hospital from the beginning of this year, and my opinion about it is very good. The device is made of casual ultrasound machine and additional ultrasound arm, which is composed of the small LCD monitor and high frequency wide transducer. One not painful exam takes about 10 minutes. for the both breasts. After exam, the pictures are sent to the archiving system and stays there for about 10 years. The scan is made only by a technologist and doctor is not present during the scan. So the patient do not meet the doctor, what is very bad for them. And of course, it is very good for us. Later, all images goes to the console where a doctor is reading them and giving a diagnosis. As you can see, for reading there are three dimensions, of which transverse plane is original and two others are generated by the software. I'm mostly working with coronal plane, which is extremely helpful because you're able to see the speculated margins of the tumor, what is not impossible to do by the simple ultrasound machine. Because of the high frequency transducer and additional coronal plane, I'm finding at least one smaller than 5 millimeter cancer every month. So the main advantages: there is highly resolution wide transducer. It takes only about 10 minutes to scan for both breasts. All images are achieved. There is no side effect. Also, there is no exposure of X-ray. And the main disadvantages for the patients, there is no direct consultation with a doctor. That is why an automatic breast ultrasound is recommended only for the females without complaints after screening mammography. During a scan, the white transducer do not cover axillary area. That's why we're not able to evaluate the lymph nodes. Also, ABVS is not suitable for the biopsy. Clinical case number 3. 52 years old patient came for the breast ultrasound after screening mammography. She had no complaints as well as the mammography images. There is 4 millimeter speculated mass in the right breast because she was the first patient with so small suspicious mass in my career. Before a biopsy, I decided to perform a MRI exam to make sure that I am on the correct way. MRI revealed that there is 2 masses and one of them is suspicious, from which I took a biopsy, and the another mass has appearance of fibroadenoma, so I decided to seek it. The ultrasound-guided biopsy revealed infiltrating lobular carcinoma. Clinical case number 4, 63 years old patient came for the breast ultrasound. She had no complaints and mammograms were never performed. Because she is not after screening mammography, the automatic ultrasound is not suitable for her. But because of an error of the hospital resection, an automatic ultrasound was performed. As you can see, there is 5 millimeters speculated suspicious mass in the left breast. I decided to make a mammography scan, and I have found 17 millimeters suspicious mass at the same location. In the opposite breast outer quadrant, there is a focal asymmetry. Because of the unknown true size of malignant lesion and asymmetry in the opposite breast, MRI scan was made. There is 13 millimeter suspicious mass in the left breast, from which I took a biopsy guided by an ultrasound, but in the opposite breast there is nodular enhancement, which is suspicious, and it was impossible to find during second ultrasound scan, so I have left it for seeking after 6 months. A biopsy revealed infiltrating ductal carcinoma. In conclusion, MRI is very powerful modality, but not suitable for every woman, because increased rates of unnecessary biopsies and further follow-up. And automatic breast ultrasound is very powerful for early diagnosis, because of high frequently transducer on coronal plane, but it is suitable only for females after screening mammography. So, thank you for your attention. Goodbye.